Thanks, Dr. Benchimol and Dr. Kaplan. I'm really happy to talk to you today about the NASPGHAN recommendations. These recommendations were actually initially developed for pediatric gastroenterologists to provide some guidance as to what to do with COVID-19. Let's see if I can move this forward. So the recommendations that we have here today, I will just touch on the points that that we found would be helpful for patients like yourselves, who or family members of patients. There we go. So we, as a group, identified multiple different sources to develop our guidelines for our physicians and providers. We really feel it's critical that we all utilize well-sourced information. The World Health Organization, the United States CDC, or the Center for Disease Control, Crohn's and Colitis Canada has a beautiful website that you should take some time to look at. And then GI Kids, which is run by the NASPGHAN Foundation, and NASPGHAN has some excellent advice and concepts that can be utilized for all of our patients. So if we start with some of the patient recommendations, the first thing that we are recommending is that patients should not stop their medication. I utilize an asterisk here because I want everyone to consider talking to their physicians about their medications and whether or not there's any need to make a change. But out of hand, the idea of stopping your medications is not a good idea. We have, as Dr. Benchimol noted, we do see that patients who have severe inflammation or are active inflammation may be at higher risk of complications of COVID or of developing COVID-19. Things that IBD patients should do are things that many of you have heard already. Avoid close contact with others that are sick. Washing your hands with soap and water for at least 20 seconds and using hand sanitizer if soap's not available. And we shoot for a hand sanitizer that's 60% ethanol or greater. It's key not to touch your nose, your eyes, your mouth if you haven't washed your hands. Obviously, if you've washed your hands, then that's the time to do that. The point here also is when we talk about face masks, in the United States, many states are now requiring or recommending the use of face masks. One of the things that face masks can do is increase the amount of times you touch your face. And so it's something to be cognizant of when you are wearing a face mask, that you're much more likely to be touching your face at those times. So to just remind yourself not to do that. And then follow social distancing as per your local government. Many places are requiring or limiting travel for the time being, specifically international travel. And then wearing face masks as per your local government. Social distancing, as was described so nicely previously, is one way to avoid contact with the virus. So then the question comes, does IBD increase your risk of developing COVID-19? And really what we know from this is what Drs. Benchimol and Kaplan had spoken about before. There's a large committee through the International Organization for the Study of IBD, where they sat down and discussed what are the concerns of different medications, what are the concerns with IBD. And we utilize these guidelines to try to define some simple guidelines for our physicians and their patients. Currently, there's no evidence that to suggest that IBD increases your risk of developing COVID-19. That being said, we do have to consider the fact that severe inflammation may possibly play a role in your susceptibility. Other health factors do play a greater role in increasing your risk of severe disease, including lung issues, heart disease, and diabetes. So then, is there any medication that I should stop to avoid developing COVID-19? Currently, the recommendations are that none of the medications that are other than prednisone which has been discussed previously, have been identified as possible risk factors. Other biologics or other similar medications are on the list of medications that should be continued. And your risk of developing inflammation due to coming off of them is greater. Then the question, is there any medication that I should stop if I develop COVID-19? This is an area where speaking with your physician is critical. There are recommendations that certain medications be held when you, if you do develop COVID-19, although we don't know the results of holding those medications yet. Again, it's the same story that you've been hearing previously, which is that we just don't have the data to state one way or the other. Although the current recommendations are that if you are on steroids, weaning your steroids is beneficial, and that you may need to consider coming off of medication somewhat such as azathioprine or 6-mercaptopurine, methotrexate, and some of these other medications that are immunosuppressant. But these again need to be discussed with your physician. I'd like to step into now is an area that we don't discuss very frequently, and especially we don't deal with that much, but we are dealing with now with the pandemic. We know that up to 40% of our patients with IBD have dealt with depression and or anxiety. And the feelings of anxiety or feelings of isolation, fear, lack of interpersonal connections, all these things are what we are going through with quarantine as well as social distancing. And this is a critical component of our health. So we talk about what are the things that can be done. It's important that parents talk to their children about their thoughts and concerns. Asking the question of, what are you thinking? What have you heard about COVID-19? And what are your concerns? Is a very simple question, but you might open up quite a bit of information. It's critical to turn off media and news for extended periods during the day. Realistically, the news is not changing that quickly, and so being focused on it, keeping it on at all times, may not be the way to decrease your stress. Set up a schedule. Scheduling is helpful. It can give people something to look forward to, something to look at as the next step in their day, especially when they're missing school, they're missing their friends, they're missing their playtime that they normally had scheduled. And then begin regular stress management practices. There are multiple websites that are available to use stress management, and I'll have a slide after this that'll talk about those. It's interesting, I have 4 children, and there are probably 20 different sites that are available for apps that can be used for mindfulness, and each one of them really finds that a different one is beneficial to them. So if one doesn't work for you, consider looking at others and trying them out. They can be quite relaxing and calming during this difficult time. So, and then for caregivers, it's important to focus on your own de-stressing, whether that's cooking a favorite meal, taking time, for yourself, relaxing, going for a walk away from the family. These are all areas where it's important for the caregivers to find ways to cope with the isolation. And then connecting with friends and family. Well, we may not be able to run out and hug our family members. It is critical to utilize video conferencing and other ways to keep in touch, to make sure our kids are staying in touch with their family members and friends. At this time, we are having so much more screen time, and I know as pediatricians and physicians, we talk a lot about not having too much screen time. This is an area where screen time is important. And then getting outside. If you can, enjoy the fresh air, getting outside, maintaining social distancing, but also being in the fresh air can be very refreshing. Staying active, running, or being active in that way might be can be a very beneficial practice. So these are some of the resources that we provide. GI Kids, as I spoke about before, has multiple resources, lots of information. Stress management sites, Headspace, Smiling Mind, Mindfulness Coach. These are all different apps that can be used. As I said, everybody's different. I have 4 children. They all seem to like a different one, but they can be very beneficial. Then making sure you're following with Crohn's and Colitis Canada. You can look at Crohn's and Colitis Foundation of America and the NASPGHAN website. And then there are some other guidelines or some other informational sites here where we look at talking to our kids about COVID-19. There's some nice information on how to do that if you're finding it difficult or finding a difficult to really get into a good discussion.